Good morning, everyone. Professor, it is I who is honored to be here amongst so many doctors and educators doing such important work. And in that spirit, I will do as Dr. Tom did and acknowledge the presence of Minister Mozzoledi, the Deputy Minister, and the DG, and then please allow me to say all protocols observed. There's a minister in Pretoria who says, "I will protocol you when I observe you," which I also like. But Minister Mozzoledi, I should say at the top that you're a personal hero of mine, in fact, because I think the work that you have done and are doing on HIV/AIDS and on health system strengthening will be quite a legacy. And I think getting the health challenges in this country right are fundamental to South Africa's continued role as a model for the rest of the world for democratic leadership and transformation. And I'm also honored to be in the presence of representatives of the Sisulu family and to hear personally how appropriate this program is as a legacy for my Sisulu. This is also a wonderful model of public-private partnership. So there are a lot of things that I'd like to talk about, and I'll try to be brief. And I'll also try to situate this a little bit in terms of the rest of our President's Emergency Program for AIDS Relief, or PEPFAR as we now just call it. PEPFAR is committed to public-private partnerships such as this globally, and we're very proud to be associated with the ASELPH Public-Private Partnership. There are 19 of these partnerships worldwide. The steering committee for ASELPH is made up of the best minds in health management policy in South Africa, but also worldwide, globally. We contribute about $3 million, or 27 million rand, to this program. And we're pleased to be able to make this contribution, but I also want to highlight that the majority of the funding comes from the National Department of Health and from other partners like Atlantic Philanthropies and the ALMA Foundation. And Bernadette, I'm glad to see you here. ALMA Foundation is also a partner of USAID in our education programs, and we value that partnership very much. The cooperation of multiple universities, the National Department of Health, USAID, PEPFAR, and other funders is a significant collaborative effort. Everyone participating should be proud of the success and that partnership. ASELPH will prepare managers, and Dr. Tom talked about this, to make more efficient use of existing resources. It will give them keys to unlock the roadblocks that separate struggling segments of the health sector from successful ones and put them on a path to improved health outcomes. And as responsibility for care and treatment program transitions from the PEPFAR programs to the South African government's direct control over the next 5 years, the success of programs like ASELPH will be pivotal in guaranteeing that the health system is functioning effectively and efficiently. That's where I kind of want to contextualize what's happening. To date, the U.S. government has provided almost $4 billion, about 30 billion rand, to help the people of South Africa combat HIV and AIDS and TB. And in August of last year, Minister Mozzoledi and Ambassador Gips signed a partnership framework implementation plan that provides a roadmap for the transition of the PEPFAR program from an emergency initiative to a sustainable long-term program. The joint plan lays out how the transition of care and treatment programs will be integrated into the South African primary health care system, and as Dr. Shao discussed, and how that will be managed in order to preserve quality of care, maximize efficiency in the use of resources, and strengthen the overall human and institutional capacity of the South African community health systems. PEPFAR and the U.S. government will continue to support South Africa in this work, but will focus after the 5-year transition primarily in prevention, research, and support for orphans and vulnerable children. So this program is particularly important to health system strengthening and to that transition. We're committed to an approach that strengthens the systems to address roadblocks and obstacles in order to increase the efficiency of healthcare delivery. The health system strengthening portfolio of USAID is about $25 million a year. The portfolio addresses human resource needs, including training new healthcare workers and supply chain strengthening, so procurement, things like that. This health system strengthening means that HIV patients will get the right drugs on time, and it strengthens the public financial management so that clinics and facilities have the right resources. All of this will be done with the ultimate goal of improving access to HIV services for those who need them. Again, it's an honor to be amongst you this morning, and congratulations on the launch. Thank you very much.
Honorable Minister, Deputy Minister, and all protocol observed, ladies and gentlemen, I am absolutely honored to be here to represent the private philanthropies that are supporting these partners and the Ministry of Health in this important endeavor. As we embark on this major effort to transform our health system, we know that the real challenge will lie in having senior leaders who are empowered to translate policy into effective and efficient delivery of health services. This is where we, as South Africans, have sometimes fallen down. We know, however, that it is possible to implement rapid and effective change. Just look at the remarkable efforts since World AIDS Day 2009, testing and treating an unprecedented number of people, curbing vertical transmission, and extending the life expectancy of South Africans. This has shown what is possible when the goal is clear and everyone is pointing in the same direction. In order to effectively transform our health system, to ensure health for all, we will need the same level of effort and focus and determination to sustain the major shifts in how we deliver health services as a country. For health system reform to be effective, South Africa needs public health leaders with the capacity to lead change and a sense of mission to be accountable to the people they serve. Whether as the CEO of a hospital or leader of a district that is charged with piloting NHI, senior leaders need broader perspectives on challenges and opportunities for health system strengthening and reform. We need to know what has and has not worked in similar settings or other countries, and they need to be able to apply these lessons to the dynamic environments in which we find ourselves. These leaders need to be sensitive and have insight into the unique leadership and management challenges that we face in South Africa. And the leaders need to be trained as executives with core leadership skills to be able to analyze, negotiate, persuade, and inspire, and to manage effectively while identifying and acting on opportunities to innovate and respond to the challenges before they become crises. In order to train leaders at this level, we need academic institutions able to make a sustained contribution towards developing senior leaders who can improve health delivery. As the Alma South Africa Foundation, we are working to build African capacity by supporting and developing local institutions to improve health and education. In this effort, we have had the privilege of partnering with other private foundations such as the Atlantic Philanthropies, and we were delighted when a few years ago they approached us with this opportunity to collaborate. And so we are very pleased that after several years of talking about this, we finally are here today, not just launching something that is still in planning, but launching something that has already taken off. Our universities are often a starting point as we plan improvements in human resources for development. And this partnership promises to build sustainability at the University of Fort Hare and the University of Pretoria. The Albertina Sisulu Executive Leadership Program represents an effective partnership model between universities, the National Department of Health, the Harvard School of Public Health, and South African partners. for ensuring that South African universities are able to support policy development and planning for health system transformation, while building human resource capacity to lead reform efforts. We are equally excited about the funding partnerships that we've developed with bilateral agencies such as USAID. Atlantic Philanthropies, USAID, and ALMA represent public and private funders using their respective strengths to support efforts of government to implement change. Finally, we honor and remain guided by the contributions of Ma Albertina Sisulu, who dedicated her life to building the health and well-being of all South Africans. And we are really honored to be a part of this effort. Thank you.